What inspires me most about being a physician is the fact that I get to work with people. I can definitely say I'm self-accused of being a people person, a talker. When I see a patient in the office and I see how well they're doing, whether they're doing great with their exercise, they're eating healthy, they're losing weight, above and beyond what I even expect. I literally stop and say to the patient, number one, you've motivated me for another 20 cases. Number two, are you interested in maybe working with some other patients so they can kind of help emulate and see what you're doing, because a very highly motivated patient can be a great asset in a program. And it definitely shows, number three, it definitely shows it can be done. And in the words of the patient, if you follow the guidelines, it works well. And if you follow the guidelines really well, it is amazing what happens. During my residency and my training and my research, I found that I was probably the only one who really enjoyed this area of medicine. And certainly once I finished my training and started to take my first job as a fully fledged surgeon with training in this field, I found that it was something that just grew and I just naturally embraced it. I started benefiting from it too, because not only was I helping my patients become healthier, they were helping me to become healthier too. I exercise more, I eat healthier than I ever did because of that, and I really appreciate those things that are good benchmarks of good everyday healthy living, because I can't really promote it to my patients if I'm not doing it myself. Well, my philosophy of care, I always give enough time to every patient based on what they need. And the way I distill that out is, I would rather sit there and spend more time drilling down with the patient and not worry about the clock or what's going on until we get done what we need to do together. Certainly seeing my patients' success stories rejuvenates me for another day, week, year of doing what I do, because I know that we're making a difference here. And then what motivates me is where we have those little challenges and we overcome those challenges. This patient may have a particular medical illness that is kind of rare, and now we're going to address that in addition to doing what we would do with bariatric surgery. And then we see how that integrates together and we get those success stories.